The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Cholesterol levels have always had a direct impact on the incidence of heart disease. Unfortunately, many people still ignore the preventative measures. In an effort to treat this problem, increased consumer service by local pharmacists is on the rise.
When we call a physician, we have all the knowledge and information that makes us an effective healthcare team member, and it benefits the patient as well as the physician.
We'll explore this topic next on this special edition of Today's Health. This program is brought to you in part by Merck Company and the American Pharmaceutical Association.
Hello, I'm Faith Daniels, and this is Today's Health. High cholesterol is a major contributing factor to heart disease. Most of us know that, and yet we don't have any idea what our cholesterol level is. Knowing that vital information and what it means may be one way to greatly reduce long-term health risks.
Coronary heart disease is a major health problem in the United States and is the #1 killer of men and women.
With the data that we've been able to collect to date, it's been definitely shown that there is a direct link between improved cholesterol parameters and lowering the risk of heart disease.
Cholesterol is produced in the liver and also enters the body through the diet. It's recycled in the liver and is carried in the blood in the form of globules called lipoproteins.
The two types of cholesterol that people understand in the general public are what's referred to as the good cholesterol, which is the HDL cholesterol. This, if you will, acts as a transport type of cholesterol to pull the cholesterol out of the body. And then the LDL cholesterol, which is the bad cholesterol. This is the one that will lay down on the lining of an artery and initiate the process of plaque formation to the point where eventually, when it becomes organized, you have a fixed obstruction or partial obstruction to the artery in that location.
Reports from the National Education Program recommend that all adults older than age 20 have a cholesterol screen performed at least once every 5 years. There are a number of ways that a patient can learn of the health risks from cholesterol. A general health checkup at their family physician, screenings at shopping malls and local pharmacies, or simply reading a newspaper or magazine article.
When I first went to the doctor for a checkup, my cholesterol was quite high. It was like 278, I think, at that time. And he knew that we should start doing something with it because my family has a history of this.
If it doesn't hurt, they don't feel like anything's wrong, and that's probably the biggest problem with people on high cholesterol is they don't feel like they're sick, so they don't feel like, well, they should do anything about it. Between 50% and 2/3 of people after 1 year of being on the medication will have stopped taking the medication. And there's a lot, I think, that pharmacists can do about that. They can be involved in a program like Project Impact, where we're giving feedback to the patients and letting them know every 3 months what their cholesterol level is. And I think that keeps people more motivated to be on their medications.
How are you? Fine enough, except I need some more medication.
Okay, let me come out and get that from you, okay? Looks like you're not feeling so well today.
Project Impact stands for Improved Persistence and Compliance with Therapy, and it is a really broad, encompassing term. In my opinion, as it started out, we realized that patients on cholesterol-lowering medications could reduce their chances of heart attacks and subsequent myocardial infarctions by 30% if they were to stay on their medications for 4 years or more. Unfortunately, greater than 50% of patients are no longer taking their medicines after 1 year. So the statistics on decreasing heart attacks aren't much good if the patients aren't taking their medications. And the pharmacist has a role to help patients make sure that their medicines are intended or have an approved use, that they are working, that they're safe, and that they're easy for the patient to use.
I think the biggest motivator for people is encouragement and telling a patient why they need to be on this medication and why it's so important to take it regularly, because a lot of patients have no idea why they're even on a medication.
I have found that patients exhibit a lot of trust in us. They come to us and tell us a lot of things that they would have never told us many years ago. I remember a lady that I was working with one day, and we were going through her medications and what she was taking something for, and she looked over at me and she said, "Marv, I'm telling you things that I've never told anybody except my doctor. I haven't even told my husband." And I just smiled and said, "Thank you, it'll stay here."
It was a surprise to me that you could have that close of communications with the pharmacist, because the more I would come in for things that I felt more confident in asking them questions, and they were able to give these answers, and now I look at them as they have the knowledge of a doctor, and it really helps, because a lot of times you are at a doctor's office and you forget to ask them questions, and then when you come to pick up your prescriptions, well, you think of those questions, so you ask, and most of the time you always get an answer. And I think that is important when it's easy to converse with them like it's almost like part of your family.
Knowing your cholesterol level is very important for each and every one of us in society, because we do know now that high cholesterol levels are associated with increased risk of heart attack. And this is a number that patients all over this country, regardless of socioeconomic status, where they work, that they do realize that a high cholesterol, it will increase your chances of having a heart attack. So it is very important that we know that number.
I had been curious on what my cholesterol was. It came back at 393.
Often, risk factors for heart disease are discovered too late. The warning signs are not always obvious.
The goal of helping patients understand their cholesterol, take steps to reduce it, and then to monitor, that is one of the objectives of the study.
Patient encouragement for successful lifestyle modifications. Coming up on Today's Health.
Following the right treatment plan can make all the difference in a prognosis. Family physicians help to reinforce our health decisions, but pharmacists are quickly becoming an important key to the monitoring and compliance of therapy.
One of the objectives of Project Impact is to identify patients who are at risk for high cholesterol, heart disease, stroke, and heart attack. This program enables patients to be evaluated and for physicians, pharmacists, and patients to work together to reduce that risk.
Total cholesterol is easily monitored in the pharmacy. Total cholesterol under 200 is desirable. Cholesterol between 200 and 240 is considered borderline and can be treated in most cases with diet and exercise. Cholesterol over 240, along with diet and exercise, sometimes needs drug therapy to be brought down.
I found out that I had high cholesterol by going to my doctor for a regular physical. He had done blood workup. I had been curious on what my cholesterol was. It came back at 393. I was scared. I lost my grandfather at early age because of heart trouble. I lost my father. He had 5 heart attacks before he died from cancer. And I knew that if I wasn't going to change my lifestyle now with the high cholesterol, that I would probably be right behind him.
HDL is a part of the screening process. We do it with each screening. HDL under 35 is a definite risk factor, a proven risk factor. Between 35 and 50 is borderline. Good therapy would want us to get HDL levels in the 50+ range. HDLs over 60 are bonus points.
The protective effect of elevated HDL is so significant that it essentially negates one positive risk factor for that patient. For example, a patient with 3 positive risk factors such as hypertension, family history, and smoking, and an HDL greater than 60 would be considered to only have 2 positive risk factors.
Over the years I've been eating a lot of fatty foods such as fast food restaurants and the occasional cakes and pies and that kind of stuff. And the exercise, I haven't exercised like I should have over the years.
If a person's total cholesterol is 200, their HDL is over 35, you should really take a look at where the risk factors are at, where their LDL is at, look at the medical guidelines and where their LDL levels are.
When you have patients with a total cholesterol between 200 and 239 and an HDL good cholesterol over 35 but less than 50, we start with diet and exercise. Looking at their other risk factors, if they have less than 2 risk factors, it's real important that they make some dietary modifications.
If a patient's total cholesterol is between 200 and 239 and their HDL is less than 35, that adds another risk factor to the equation.
Diet is the first step in reducing cholesterol. All patients should receive detailed counseling on the types of foods to avoid and the importance of lifestyle modifications.
The red meat's been the hardest thing to cut out. I like chicken, I like fish, but if I go to a restaurant, I would much rather have red meat.
Diet modification is one of the most difficult things for the patient to comply with. We encourage them with examples of low-fat foods, watching their fat calories, give them sample diets.
To change my lifestyle was hard because I own a business, I work an average of 70 hours a week, I don't have time for exercise, I don't like to exercise, but I thought I have to get some type of walking in. My cholesterol level right now is at 230. I've taken off approximately 18 pounds, and I have learned to eat chicken and fish at more opportune times instead of hamburgers or steaks.
I believe in this day and age that a patient pretty much has a good idea what their risk factors really are. You know if you're a little bit overweight, you know if you're laying in front of the TV, you know if you're not eating right. And sometimes it almost takes a catastrophe, a neighbor, a relative that does happen to have a heart attack, for that patient to come forward.
When we're treating and helping a patient with a lipid disorder, we're also looking at any other possible disorder they might have, any disease state, any other medications, any disabilities or lifestyle problems that might affect their total health. We're basically taking responsibility for all the drug therapy and patient care for that patient. With our testing here, we can show on the cholesterol machine exactly how much the risk factors are reduced by decreasing the smoking and taking the factor out of the equation.
Hey, Woolley. Hey, Don.
How you doing?
Good. Yourself?
Not too bad.
Got everything taken care of after we talked to the doctor? Got your prescription all set to go? It's very valuable for the patient to have accessibility to any healthcare provider. Being a pharmacist, the patient usually comes in monthly for their prescription refills. With the Impact Project, we test them 1 month, 2 months, 3 months, and every 3 months after there. It's easy for them to come in to get the appointment. They get their levels done right away. We are able to spend time with them, answer all their questions.
The fact that a pharmacist sees a patient up to 10, 12 times a year, helps us facilitate answering any questions they might have when they come in to see the pharmacist, address any problems that might have developed, any changes in their lifestyle or personal health. We see all the other conditions, or medical conditions that they're being treated for. Sometimes if they see multiple doctors, we can coordinate the care to these doctors and make sure they all are aware of the total health of the patient.
I feel I have a lot of trust in my pharmacist. I come in and he greets me, he calls me by my first name. Everything I feel is real confidential here.
The trust that I have now in a pharmacist, in their filling of the prescription and giving it to me. Before I thought they just put it in the bag and sent you home and told you should take this with food or you should take it without food. Since the education that Marv has given me on raising my HDLs and lowering my LDLs to try to balance everything out here for my total cholesterol, he's more informative. The doctors prescribe the medicines, but the druggists and the pharmacists are the ones that inform you what they really do.
In a couple of weeks, finish up the good work.
Thank you very much.
Continue to drop nicely. We're hoping.
When diet and exercise are not enough, more aggressive therapy might be needed.
When patients have had an adequate trial on diet and exercise, we usually move towards more aggressive therapy of looking at drug therapy interventions.
How important is the relationship between patients and their pharmacist? We'll explore this next on Today's Health.
Treatment options for many diseases can be confusing. Today, pharmacists are available to help you make educated decisions and act as a valuable support system for maintaining control of your overall health.
For some patients with elevated cholesterol levels, sticking to a diet and exercise program that their physician or pharmacist prescribes is enough to make the necessary level adjustments. However, there are others that need more aggressive therapy.
Mary Alice, it's Ruth. I'm returning your call.
Yes, I just called to confirm our appointment for later this morning for your cholesterol monitoring. When patients have had a trial on an adequate trial on diet and exercise, we usually move towards more aggressive therapy of looking at drug therapy interventions. And we have about 4 or 5 classes of drugs that we can use to choose from, depending on how much of a reduction in their LDL we need to reach their target goal. When a physician prescribes a medication and a patient brings that prescription to me in our cholesterol management program, I'm interested in looking at what percentage of reduction of their LDL they need to reach target, so that I want to make sure that that drug or combination of drugs is going to be adequate to reach that reduction to reach their target LDL. I'm interested in what other kind of disease states they may have, because in some classes of drugs there might be a contraindication to a use of certain drugs, such as like diabetes or peptic ulcer disease or gout. So I'd be looking for contraindications. I'd be looking at what other medications they're on to make sure there wasn't anti-drug interactions.
When I first found out that I had high cholesterol, a prescription was given to me almost right away. I had gone a couple of times to the doctor before that, where there were some indications it was climbing. But when he gave me the prescription, I left his office that day still hesitant about adding any medication. Some of that was because he had given me 2 prescriptions for 2 different health conditions. And again, I just thought there's more medicine going into my system.
I think one of the #1 questions I get from patients when they start on drug therapy to lower their cholesterol is that once I get my cholesterol level to the target, will I be able to stop taking this medication? And I think we have that mentality. It's kind of like a penicillin mentality, that we cure it and then we move on and we don't need the medication anymore.
A lot of times patients, just because they don't feel bad, don't think they should take their medication. The program is set up to increase the patient compliance. They come in, get their levels done, and can see in black and white from the printouts on the CholesTech machine that as their levels go down, so does their risk.
Hi, Ruth. Oh, hi, Mary Alice. How you doing? Hi. Good to see you.
At the first visit, we look at setting realistic goals, particularly for diet and exercise. So we look at what risk factors need to be modified and set up realistic goals with that patient to be able to reach those goals. I find in routine practice that patients tend to not be compliant on lipid-lowering therapy. They don't have symptoms of disease, so they're less likely to stay on their medications. The patients that we've had enrolled that had issues with taking their lipid-lowering drugs, a patient like Ruth was apprehensive to take medications and because she had multiple medications on board already. So working with them to show them the importance of why they need to take it really helps with the compliance issues.
When I talked to Mary Alice in the cholesterol management program, the confidence that came because she said, let's try one medication at a time. Let's see how you do on it. As I saw the results, which were immediate, within the month, the numbers were coming down. I became much more aware that I needed to do the therapy that they had given me to do. When it comes to counseling, so much of it was education for me. I came to more knowledge about the HDL, which is the good cholesterol in your system, and the LDL, which is the bad cholesterol in your system. One of the things that helped me tremendously was a picture of a cholesterol road that was done graphically so that you could see that the foods we eat, especially from meats, I should say, and the liver also, they both add cholesterol to your system. And the good cholesterol can help remove, or the HDL, can help remove the LDL from your system by almost pushing it out. And so that was a very graphic, educational tool for me.
Hi, Willie. Come on in.
Wanted to double check on the status on Don's cholesterol medication.
The combination of the pharmacist along with the physician working together has greatly increased my ability to take care of patients. The medications that are required for a lot of the chronic disease management regimens are closely monitored by the pharmacist, and it allows me to tend more to the overall care of the patient.
With the proper training, with the use of the cholestic LDX analyzer, pharmacists can measure patients' cholesterol, provide that information back to the physician, educate patients on their cholesterol numbers, counsel patients on their medication use, and we believe through this program, improve patient outcomes.
What better place to monitor a patient's pharmaceutical intervention than through the pharmacy?
If you're on the internet already or thinking about it, you'll be amazed at how much information there is concerning your health and well-being. For a good start, visit our Today's Health website at vstar.com. If you want more information about the topic discussed today, visit our website at vstar.com. I'm Faith Daniels. Thanks for joining us, and we'll see you next time as we get right to the heart of matters concerning your life on Today's Health.
To purchase a complete written transcript or a videotape copy of this or any edition of Today's Health, write to this address or call 1-800-877-7769.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.